Yet another context that we experience on a regular basis is that of healthcare, when we are interacting with healthcare providers. Now, some of you may not have been sick very often in your life, and so you haven't had to go to the doctor very often. You haven't had to interact with office staff or nurses or doctors in a regular basis. However, most of us throughout our life will visit the doctor a number of times, probably have a number of different problems in which we have to take medicine in order to treat them or to overcome them. And in all likelihood, you're going to have to assist with the care of somebody that will become dependent upon you and others at a certain point in time, maybe a family member or a very close friend. Research emphasizes the value of positive interpersonal relationships between healthcare providers and patients, and health communication researchers have really focused on a lot of relationships between doctor-patient, doctor-doctor, nurse-doctor, nurse-patient. I mean, you can go to all the different dyadic relationships they study. They've also studied healthcare units as a whole and the culture that they have, and so it's more of an organizational standpoint on relationships within healthcare contexts. But there's one in particular study that's interesting that was conducted by Chang and colleagues in 2006 that looked at, in terms of different qualities of healthcare and the kind of care that you receive. They looked at 236 vulnerable elderly adults in managed care facilities, and they had them rate their interpersonal quality with healthcare providers, the technical quality of care that they received, and the amenities. Now, what's interesting is that interpersonal quality of care correlated with higher ratings of care, but technical care did not. So what's interesting is that if they have a good relationship with their healthcare providers, they're going to perceive that they're receiving good quality technical care, whether they are or not. So this is a challenge for healthcare providers, because just because a patient is satisfied does not mean that they've necessarily done their job to fruition. But it does tout the importance that a relationship has to the perceived quality of care that the patient is receiving. Now, doctors have really, transitioned and evolved quite a bit in the way that they view the relationship with patients. And it's not a consumerist mentality that many people are trying to impose upon the doctor-patient relationship. Some research conducted by Suckman and Matthews, and then a response by Stent both in 1998, looked at the relationship between patient and doctors is that of being therapeutic, and that being a better analogy to the kind of relationship that they have, as doctors and patients really collaborate together for the care of the patient, and they contribute to one another with information. They develop interpersonal bonds between the relationship, and doctors see their role in terms of the therapeutic relationship as being one of a listener and one of a helper, but not necessarily as a person who determines exactly what you need to do, because they're more of a collaborator. Also, doctors have deemed that their relationship is very special because they've been allowed to be a part of a patient's life during a very difficult time period, and that patients oftentimes see the doctor as being one of the only people that understands what they're going through, because they see patients with similar difficulties on a regular basis. Now, there are a number of different problems related to communication within healthcare, and they've been documented by a number of researchers. Dr. Lyle Wittenberg from the University of North Texas, she has documented a lot of problems related to palliative care, which is later life care within the hospital, and hospice care, and how to overcome those and improve family relationships and relationships with healthcare providers when your loved one is dying. And there are a number of researchers in health communication that are now working at medical institutes, and they are training doctors in improving their communication with their patients, and it's becoming a part of medical school rather than something that they just learn on the job. And what's very interesting is there's a lot of research related to obtaining patient histories, because when you provide a doctor with your patient history, you're giving them all the information that they're going to have to go on besides any medical tests that they run, but your patient history determines in many cases the medical tests that are run. But that's the primary information they have to go on to make a diagnosis in order to help you. Or if you're providing a patient history of a loved one, which happens in many cases. Now, what they found in research hospitals where you have residents and attending physicians, a resident will go in, and there was a study that was conducted where they videotaped the resident patient attending physician interaction. And the resident would go in and take the patient history, they would come back, they'd tell the attending physician, and because of rules related to how attending physicians and residents treat patients, the attending physician has to sign off on the care, and so they have to meet the patient as well. So the attending physician will listen to the resident's idea of the diagnosis, and then the resident will go in and get another patient history, ask basically the same questions, and then come out, confer with the resident again, and then they'll make a joint diagnosis. Now, what they found in the videotapes was that patients would give one history to the resident, and lo and behold, their patient history would change for the attending physician. And some people have accredited this because the patient was negligent, or they've tried to attribute this to, well, the resident wasn't able to obtain a good patient history, or the attending physician had more credibility. It's probably a combination thereof, but you're responsible for your own health care. And if you are giving your patient history, what happens is the first time around, you may forget some important details, or you might feel like maybe I downplayed that too much, and maybe I should mention this when I see the doctor again. And so when the next doctor comes in, you add to it, you fill it out, you make it more full. But if you're more prepared to give your patient history to begin with, then it wouldn't have been a problem, right? Also, consent of care is very important in healthcare contexts, which means that you have to have the doctor has to have informed consent of the patient to treat them, which means the patient has to listen very carefully as the doctor provides information to them. And if you are given anything to read, you have to read it. One of the problems that patients face is that they don't ask questions. And so they get a diagnosis that they don't completely understand, or they're given information about treatment and they don't completely understand. And they don't ask their doctors. Now, the Ad Council right now, along with the U.S. Department of Health and Human Services, is sponsoring public service announcements and a campaign that is encouraging patients to ask their doctors questions. And ask them about difficult terms. Well, what does stage 4 cancer mean? And what does fibromyalgia mean exactly? And what are the different symptoms? Are there any tests that we can run if you think I have rheumatoid arthritis? You know, you're asking those sorts of questions. What exactly is swine flu, and how is it different than the regular flu? Now, there are some skills that we can use to build our own communication repertoire as we are in these listening contexts. One is that we can engage in perception checking. Reword things in your own language without the medicalized discourse in a way that you can understand it and see if you're right. And ask some probing questions of the healthcare provider to know if there's some more detail that you're not getting, there's something you're not understanding. I mean, ask. Also, you need written documentation of your visit. My Nana and Pawpaw have had an incredible and miraculous health history. And my Pawpaw has had he doesn't have an esophagus because he had it removed because he had esophageal cancer. He had quadruple bypass surgery on his heart about 10 years after that. And, I mean, they had to consult a number of different specialists because his internal organs weren't in the right place. And he was in the hospital for 4 months when he had quadruple bypass surgery. He had to have his gallbladder taken out at the same time as well. And it's just one thing after another. And my Nana, she had so many different doctors coming in. She just had a notebook and she wrote everything down. And to this day, every time she goes to a doctor, she writes things down. She has a journal of how he's doing, if he has a temperature, how high it gets, and everything, so that she has a very thorough account to give doctors, and she has a very thorough account when she leaves a doctor's office. Demand attentiveness for the doctor. They may have a busy schedule, but you need their attention when they're with you. And many doctors are good about doing this, and some doctors aren't, though. And so if you need to demand more attentiveness, then do so. Or if you need to schedule an additional appointment, ask them about that. If you want to speak to the doctor rather than just the physician's assistant, voice your concerns related to that. I know I have before. And remember that communication is two-way. We have a tendency to think that doctor is the authority. They're going to tell me what to do. I'm just going to do it. Well, you need to collaborate with them. You need to tell them what your concerns are. You need to tell them what your insecurities are related to certain treatments. And you need to ask them about side effects. And it needs to be two-way. It doesn't need to be one-way. And hopefully these skills will help to improve your healthcare communication encounters that you have. And even though you may not be going to the doctor a lot right now, these are skills that you use for a lifetime. So please, if you put them on the back burner, at least don't put them away completely, because you're going to need them at some point in time.